Hello, welcome to my channel Aim to Alter, which will transform your life positively. My last video was about the global impact of COVID-19, where I introduced the 9 vaccines that are approved by WHO. In this video, I am going to be telling about vaccines taking the example of Pfizer BioNTech. So stay tuned. Fear of vaccination was seen in people initially being afraid of what is being injected into their bodies. Well, let me tell you that COVID-19 vaccine ingredients are safe. Nearly all of the ingredients in COVID-19 vaccine are ingredients found in many foods that are fats, sugars, and salts. It is impossible to compare vaccines head to head due to the different approaches taken in designing the respective studies, but overall, all the vaccines that have achieved WHO emergency use listing are highly effective in preventing severe disease and hospitalization due to COVID-19. Research has proved that Pfizer BioNTech COVID-19 messenger RNA vaccine is safe and effective. Basically, the Pfizer BioNTech vaccine contains harmless piece of messenger RNA. The COVID messenger RNA teaches cells in the body to create an immune response to the virus that causes the COVID-19. This response helps to protect from getting sick with COVID-19 in the future. After the body produces an immune response, it discards all of the vaccine ingredients just as it would discard any substance that cell no longer needs. This process is a part of normal body functioning. Since the vaccine supplies are limited, it is recommended that during vaccination, priority be given to health workers who are at high risk of exposure. Then come the older people, including those aged 65 or older, to be vaccinated with Pfizer BioNTech COVID-19 messenger RNA vaccine. Comirnaty is the brand name for Pfizer BioNTech COVID-19 vaccine. The vaccine is safe and effective in people with various conditions that are associated with an increased risk of severe disease. These diseases include hypertension, diabetes, asthma, pulmonary, liver or kidney disease, as well as chronic infections that are stable and controlled. Vaccination can also be offered to people who have had COVID-19 in the past. It is also considered to be safe during pregnancy. WHO does not recommend delaying pregnancy or terminating a pregnancy due to vaccination. Similarly, it does not recommend discontinuing breastfeeding because of vaccination. However, people with a history of severe allergic reactions to any component of the vaccine should not take it. A severe allergic reaction can cause a rapid heartbeat, difficulty breathing, swelling of the throat, and a generalized rash. A person with a severe allergic reaction needs to be treated with epinephrine and should seek immediate medical attention. This vaccine is safe for use of those aged 5 and above with an adjustment in recommended dosage for those aged 5 to 11. But WHO recommends that countries should consider using the vaccine in children aged 5 to 17 only when high vaccine coverage with 2 doses has been achieved in the high priority groups as identified in the WHO prioritization roadmap. So the vaccination process may work systematically. On top of the list comes the health workers, since they are high risk of getting the disease. Then come the older people aged 65 or above, and last come the children aged 5 to 17. After vaccination, a protective effect starts to develop within 12 days, but full protection requires 2 doses, which WHO recommends to be administered within 21 to 28-day interval. Studies have shown a high public health impact where the interval has been longer than recommended. The maximum delay in the case of vaccine supply constraint can be up to 12 weeks, but not more than that. A booster dose may be considered 4 to 6 months after completion of the primary vaccination series, though this is mainly recommended for the high priority group users per WHO prioritization roadmap. booster is still something new, we can say. The need for and timing of booster doses for children aged 5 to 11 years has not yet been determined. In cases 2 doses of Pfizer vaccine may not be possible, other vaccines can be used in combination. Janssen or AstraZeneca can be used as second dose following the first dose of Pfizer vaccine depending on the product availability. The Pfizer vaccine can also be used as second dose following the vaccines such as Sinopharm, Sinovac, Bharat or Janssen or AstraZeneca. Vaccination certainly reduces the chances of getting COVID-19. Based on the evidence from clinical trials in people aged 16 years and older, the Pfizer-BioNTech vaccine was 95% effective at preventing laboratory-confirmed infection with the virus that causes COVID-19 in people who received 2 doses and had no evidence of being previously infected. In clinical trials, the Pfizer-BioNTech vaccine had more than 90% efficacy in preventing laboratory-confirmed COVID-19 infection in children aged 5 to 15 years. Moreover, the immune response in children ages 5 to 15 years was at least as strong as immune response in people ages 16 to 25 years. In clinical trials, the vaccine had also 90% efficacy in preventing COVID-19 among people of diverse age, sex, race, and ethnicity categories and among people with underlying medical conditions. Evidence shows some variation in levels of protection by the vaccine. All authorized COVID-19 vaccine provides substantial protection against COVID-19 hospitalization. The vaccine was also effective against virus variants, though for the Omicron variant, vaccine effectiveness against severe and mild disease after 2 doses is lower compared to Delta and waning is more rapid. As there is currently insufficient evidence available related to the impact of the Pfizer-BioNTech vaccine on transmission or viral shedding, so in the meantime we must maintain and strengthen public health measures that work. Masking, physical distancing, hand washing, respiratory and cough hygiene, avoiding crowds, and ensuring good ventilation. I hope you liked this video. Please don't forget to like and subscribe. If you have any comments, leave them in the comment section below and I will surely get back to you. Keep watching my upcoming videos. In my next video, I'll be telling about how people tend to get COVID after being fully vaccinated. So why do people get COVID after vaccination? Find it out in my next video. Thank you for watching and I'll talk to you again in the next video.